Good afternoon, everyone. In this year's throne speech, the government of Bermuda has reaffirmed its intention to implement universal health coverage for all of our residents. Our vision for healthcare seeks to ensure that all people have equitable access to needed, informative, preventative, curative, rehabilitative, and palliative essential health services of sufficient quality to be effective, whilst also ensuring that people do not suffer financial hardship when paying for these services and critical medicines. Bermuda is fortunate in that we have a health system that is well developed and well supported by dedicated professionals. However, the overall affordability and sustainability of our health system is deeply concerning for this government. Bermuda has one of the highest per capita health expenditures globally, but our population health outcomes do not reflect this at all. Continuing with the status quo in the hope that this situation resolves itself is not a responsible option. Change is required, and the journey is indeed complex and one which we will all travel together for several years as we seek to ensure better health outcomes, particularly of our chronic disease management, essential health services that residents can be confident that they can afford when they need them, and the elimination of waste and duplication when it occurs. Having committed to universal health coverage, or UHC, the Ministry of Health was tasked with developing the way forward. To do so, the ministry brought together a core group of stakeholders from across our health system to serve as the UHC steering committee to develop the roadmap for strengthening Bermuda's healthcare. The UHC steering committee is led by the Ministry of Health and comprises representatives from Bermuda First, the Bermuda Medical Doctors Association, the Bermuda Health Council, the Department of Health, Bermuda Hospitals Board, the Health Insurance Department, the Ministry of Finance, and a patient representative. And all of our work is being supported by KPMG. In this process, the steering committee took note of healthcare systems in other jurisdictions, large and small, who have already taken their first steps on this journey. It is clear that there are many paths to reach universal health coverage, and it is advocated by the United Nations and the World Health Organization, but the approach taken here on our island must be Bermuda-centric. Examining our health system, the UHC Steering Committee identified a number of actions to prioritize for its strengthening, and these can be grouped into the following three areas: stewardship and governance, healthcare service delivery, and health system value and financing. With respect to stewardship and governance, this is the foundational framework for our health system. This is where vision and strategy are set, population health needs are understood, transparent responsibility and accountability are established, and organizational and legal structure are implemented. For example, with respect to transparent responsibility and accountability, identified actions include setting standard metrics for measuring and monitoring system and population health performance and public reporting of those results. How does Bermuda measure up against other jurisdictions in terms of our population's health? Questions such as how does Bermuda measure up in terms of our best practices? Strengthening healthcare service delivery involves ensuring that all residents have equitable access to essential healthcare integrated in an efficient manner and which produces good patient experiences as well as good health outcomes. Identified actions in this area include determining what are the essential healthcare services, what approach do we take to deliver those healthcare services, how do we take advantage of advancements in information systems to better manage patient care? Concerning health system value and financing, this is a very challenging aspect for Bermuda. As stated previously, our health expenditure is high and does not match our health outcomes. However, before making abrupt changes to achieve a sustainable health system, it is crucial to fully understand current and future costs, both at a system and individual patient level. Therefore, identified actions include, but are not limited to, confirming current baseline costs, modeling future costs, as well as the sustainability of the make no changes option, identifying savings opportunities across the health system, and establishing a process to map baseline patient cost and model essential health care benefits. Whilst the pandemic delayed work on plans for universal health coverage as the ministry, hospital, health council, physicians, and our allied professionals across Bermuda joined in the fight against COVID-19, this delay created space and time for the ministry, working closely with the UHC steering committee, to develop a refreshed approach to health system change. And as a result, the many actions identified as necessary to strengthen Bermuda's health system are based on and framed by a patient-focused approach that places patients' experiences and outcomes at the center of the work on universal health coverage. For year one of the initial 3-year roadmap for universal health coverage, it is fundamental and foundational in nature. 3 of the year one areas of work are mentioned in the throne speech. Number 1, digital health strategy. Establishing a national strategy for digital healthcare and data that leverages health information systems to harness improvements and efficiencies for patients, healthcare providers, and health system payers. Integrated patient pathway for essential care. Implementing a patient pathway approach, which focuses on a patient's journey or pathway through the healthcare system, allows us to examine the fragmented components of healthcare and the cost involved at each point that care is delivered. A pathway can be a particular patient group, such as maternal child care, or a disease, such as kidney disease or heart disease. By following a pathway from start to finish, we can better see opportunities to improve the patient experiences and outcomes and address any duplicative, wasteful use of resources. Commence merging of the administration of government healthcare plans. Review and implement a merger of the administrative functions of the government plans, and a portion of this work was undertaken when the health insurance plan and future care were consolidated under the health insurance department. This administrative merger would represent the completion of this process and involve GEHI and funds controlled by financial assistance and other patient care subsidies. The other areas of work for year one involve the following: setting up the organizational structure of stewardship and governance, which including new working groups for collaboration with stakeholders, determining the baselines required, for example, for our health needs and the metrics to measure our performance, and establishing the economic case for strengthening our health system. Vitally important for the work on universal health coverage is the engagement of and the collaboration with the broad group of stakeholders who form part of Bermuda's health system. There are many questions to answer and decisions to make that will need broader input that is represented solely in the UHC steering committee or the ministry itself. In the coming weeks, the ministry will be meeting with the executive and membership of those represented on the steering committee, as well as private insurers, Bermuda Medical Council and Nursing and Midwifery Council, the Bermuda Chamber of Commerce, the Bermuda Employers Council, ABIR, ABIC, and of course, our union leaders and others. The purpose is to share the roadmap for achieving universal health coverage and the work done thus far, and more importantly, that the work that needs to be done, we will share that information as well. We know their insight and feedback will be invaluable as we improve healthcare access, experience, and outcomes for all that live here in Bermuda. And finally, I'd like to take this opportunity to thank the UHC Steering Committee for their hard work to date. This is the beginning of a multi-year journey with challenges and complexities in front of all of us. I very much appreciate your contributions, which have put Bermuda on a realistic path to achieve universal health coverage. Thank you.
Good day, Bermuda. Today, I will provide an overview of the Ministry of Education's throne speech initiatives and areas of focus for this upcoming legislative year. Education plays an integral part in this year's throne speech theme: social renewal and economic recovery, working together to move Bermuda beyond the pandemic. Since the onset of the pandemic, we have had to look at and think of the delivery of education much differently than ever before. The impact of the pandemic has been significant to our educators, students, and parents. COVID-19 has shifted the educational culture of learning in that we have had to learn how to seamlessly move between in-class teaching and remote learning. Educators and students have adapted and put their best efforts forward. Parents have persevered through the challenges of virtual learning while maintaining their work responsibilities. And educators and students have become vigilant of their surroundings and put health and safety at the forefront of their daily actions. Our educators, students, and parents have displayed an unwavering resilience and strength as they have pushed through the social and emotional stress brought on by the pandemic. I am grateful that they have all risen to the occasion and worked together to thrive despite the situation. It is now time for us to look beyond the pandemic and move education forward. A well-known advocate for children, Ignacio Estrada, stated, "If a child cannot learn the way we teach, maybe we should teach the way they learn." Education reform is this government's priority and has been the focus of the work of the Ministry of Education. As shared in last year's throne speech, a bill would be advanced to address the needed changes in the public school system. I am happy to share that this was done through the passing of the Education Amendment Act 2021. This amendment paved the way for the phasing out of middle schools and the introduction of a two-tier system with parish primary schools and senior signature schools. The introduction of signature schools would not have been possible without this legislation. In September 2022, Cedar Bridge will see the introduction of signature learning programs in STEM, which stands for science, technology, engineering, and mathematics, and in the trades and professions. The Barclay Institute will have signature learning programs in financial and insurance and health and social care. After many months of preparation, community consultation, and research, during the next few weeks, the signature learning programs will undergo prototyping. This will involve testing the proposed features of these new programs, such as what and how young people will learn and be assessed, what kinds of partnerships will be required to deliver the signature curriculum, how can we support and upskill our teachers, and most of all, what changes will be needed to make these programs most impactful for Bermuda. Prototyping will allow further engagement of students, parents, educators, the business community, and any interested person who wishes to participate. Bermuda, this is yet another opportunity that is necessary and critical to ensure that we utilize the input from stakeholders and Bermuda at large to drive education reform forward. I urge anyone who wishes to participate in the prototyping sessions beginning the week of November 15th to visit www.moed.bm and click on the alert link to register. Education can bring the desired change in the future. If you want to shape the future, shape the education system accordingly. While much discussion has centered around the transition of parish primary schools, the phasing out of middle schools, and the introduction of signature schools, education reform involves several streams of work that are occurring concurrently, and these efforts will continue to be advanced in the next legislative year. Teams from the Ministry of Education, the Department of Education, the Board of Education, Bermuda First, teachers, students, and members of our community will continue to work together to transform public education to meet the educational and vocational needs of our students. There is extensive work ahead, and teams have been assigned to carry out specific targeted responsibilities. These include the governance structure and accountability team. This consists of members from the Board of Education, the Ministry and Department of Education, Bermuda First, and Innovation Unit. Their focus is on creating an education authority to oversee public education to lead all aspects of performance and accountability in public education. Much work has been done in this area, and their initial report will be released in the coming months. The Learning First program, which is led by the Education Governance Team, Innovation Unit, and the various schools and system transformation teams. Their focus has been both redesigning what happens inside schools and collaboratively designing an improved school system with a focus on what matters the most: learning. These teams are responsible for the development and testing of our first signature schools for S1 students in September 2022, the design and development of parish primary schools, the development of the additional signature schools that will be eventually introduced in the coming years, and the redesign of the Department of Education to ensure that the right conditions are in place for new models of learning and teaching to thrive. With their help and with yours, we will redesign different aspects of public education that need to change to make it both authentically Bermudian and effective. The school buildings realignment process, which is led by a strategic program and project plan in which an RFP has recently concluded. The realignment of our schools is necessary to remove the middle school system and create a two-tier system of primary and senior signature schools. As the parish primary school consultation has been completed, the next phase of planning, designing how the transition and rebuilding of our primary schools and signature schools will be done over the next 5 years is underway. It will be critical that the planning for this phase be done to provide as minimum disruption to our children's learning as possible. It will also be equally critical that this plan include details about the necessary finances and financial planning needed to ensure the outcomes required. The History and Legacy Committee. This was an idea born out of the parish primary consultation process. Based on the feedback received, it was clear that our country has done a poor job of recording our educational history. This has been a huge disservice to our culture and our communities. After reaching out to Bermudians experienced in historical preservation, both based in Bermuda and overseas, we will be announcing shortly a working group that will develop a long-term plan for preserving our rich educational history and legacy. We will continue to provide opportunities for collaboration to ensure the voices of our stakeholders are part of the foundation of education reform. We intend to keep the guiding principles of transparency, inclusivity, and engagement to redesign the public school system to produce a system the Bermudian public deserves. Giving is not just about making a donation, it is about making a difference. Public education is critically important to the success of any country, as public education is the only comprehensive education system in any country. The United Nations Article 26 states, "Everyone has the right to education. Education shall be free, at least in the elementary and fundamental stages." The requirement and the ability to have a public education system that provides a quality experience for Bermudian students requires all of us to move in the same direction. I am proud to sit here today as the Minister of Education and able to speak of significant partnerships that have helped our students and system thrive, even in the midst of a pandemic. The donation of the Hasso-Plattner Foundation has resulted in every one of our students from P3 through P6 having a Chromebook in their hands. Countless small and mid-sized donations have placed devices in the hands of several middle school and senior school students. The recent donation of our exempted business partners will provide nearly 100,000 lateral flow tests, which will be used to enhance our COVID screening program. However, one partnership that I wish to mention in more detail is the donation of funding to the Bermuda College to construct the new Career Development Center and various other upgrades. The Athene Career Development Center has been constructed due to a $3.8 million donation from a group of international companies located in Bermuda. We look forward to the grand opening of this facility, which will include the Authora Division of Professional and Career Education offices, along with a model classroom, the Catalina Classroom, a model computer lab, Authora Computer Lab, and the Aspen Innovation Lab. The Innovation Lab is a flexible and collaborative space for exploring and sharing ideas and concepts, mentoring in various industry experts, virtually and face-to-face, and professional development opportunities to enhance knowledge and competency in the technology space. This space will be open to Bermuda College students and the community and will include a 3D printer, a 3D scanner, educational robots, and prototyping equipment. Additionally, the lecture hall in Hallett Hall has been upgraded to support local and international training seminars, webinars, and the like. Lastly, the IT infrastructure has been upgraded to include doubling the bandwidth on campus, replacing old network cabling, a new telephone system, a new firewall, and a modern digital workspace. The grand opening is scheduled for later this month. The unrelenting effects of the pandemic have prevented us from moving as fast and as nimbly as some has desired, especially with education. Every day, we field calls from parents and our private school partners asking for COVID guidelines to be changed or modified. I get it. I get it, and I understand the COVID fatigue some of us are experiencing. However, we cannot and we will not allow COVID to prevent us from moving forward. In the face of adversity, our school staff have been nothing less than phenomenal. Their commitment to go the extra mile to ensure our students get that extra boost during the last 2 years has been commendable. They are a testament of what can happen when you make the decision to look at the cup as half full, and our country owes them a level of gratitude. To everyone from the custodians to the principals within our school, to the staff at the Department of Education and the Ministry of Education headquarters, to the teams working hands-on with education reform, I thank you on behalf of the government and the people of Bermuda. We will continue to forge ahead and do the necessary work to transform and reform public school education so that all students can lead personally and professionally, compete locally, and contribute globally. We will transform education and provide a public school system that produces students equipped for vocational, academic, and multifaceted careers that they have chosen based on their passion and supported by our resources. There is a lot of work to be done. We rise to the occasion to get it done. We will continue to work alongside Bermuda and encourage Bermudians to work alongside us to make the necessary changes that will bring education reform. Focus on what is best and required every day to build a better and fairer and stronger education for our children and Bermuda's future. Thank you.
We'll start our media questions with Maya. Media Maya, thank you.
Good afternoon. Maya Palacio here from Media Maya. My first question will go to you, Minister Diallo Rabain, about education. Now, these are a little bit more detailed, so I appreciate if you don't have the answers, but what type of certificate will the students be graduating with when they start moving into the signature schools from like Berkeley and Cedar Bridge?
The signature school programs involve attending high school and attaining the Bermuda high school leaving diploma, along with about 30% of their time will be spent in the signature programs. So it's a signature program that's in addition to what they're already doing in high school.
Okay, good. So they'll still be getting the standard GCSE as well inside the whole
They will
program.
still do the standard the standard curriculum, which will be enhanced and changed as we move forward. But the purpose of this is to provide them with opportunities to explore the signature programs, to provide them with the opportunities to get whether it be work release, whether it be internships, apprenticeships, but experience and exposure to vocations that they may be interested in. So when they leave high school, they're not only leaving with a high school diploma, they're also leaving with some experience that they can either transition directly into the workforce or continue on to tertiary education to gain more education degrees.
Thank you.
Sure.
So what does it look like for the teachers in the positions that they are right now and having these new, like, obviously signature schools? Who's going to be teaching those classes? Will some teachers be taken out of other schools to fill in those gaps? Like, what does that look like?
Well, that is what when I talked about the collaboration that we've been having and the planning with the system transformation teams, that's exactly what's being looked at. What teachers already exist within the school system that can transition over to teaching more in these signature programs. What skill sets need to be provided to allow teachers to skill themselves up to reach into there. And so the system transformation teams, which were formed from persons within the senior schools themselves, as well as external sources. I think they total about 70 people in total for these transformation teams. They're the ones that will be looking at what needs to be done in order to ensure that our teachers are ready to move forward with the signature programs.
All right, thank you. And another question about the schools. Let's say, for example, I'm in primary 6. The year September 2022 is coming on. Do I stay at my same school and go to primary 7? As I said, or do I also have to switch schools because I might be in a different parish now? So.
Well, that's when we talked about when I talked about the RFP. when I talked about the RFP that that we have just put out there, that will really start mapping the way forward, because there's going to have to be a transition program. Right now, we have a 3-tier system, and we're moving into a 2-tier system, which will require a minimal, will require some disruption to what is happening now. So there may be in cases where you'll see a school, an entire school population transition over while we're doing work at one particular building. This is why we've always stated that this will occur over an approximately 5-year span, because we want to do it as methodically as possible to prevent as much disruption as possible. So the core of the planning of this will start in the beginning of next year, now that the RFP process is over. And so we'll be having more announcements on that. And we've always committed to ensuring that our stakeholders are well versed and they're in the loop of what it is we're doing way before it actually happens.
Okay, thank you very much.
Sure.
A question for you, Minister of Health. When it comes to universal health coverage, just help me to understand what it means fully. Does this mean that there will be one entity that's like one insurance company that will cover every Bermudian's health insurance?
No, not exactly.
Okay.
Universal health coverage, as announced and defined by the United Nations, and I'll paraphrase, is the provision of healthcare services that are affordable and that are in line with the needs of the patient. The government is committed to making sure that our universal health coverage is putting the patient at the center of the coverage. So you may recall a couple of years ago when we engaged in an extremely lengthy process concerning consultation of how to pay for universal health coverage, and we ended up with a single payer system. That was the what. Now that was the how. Excuse me, how are you going to pay for it? Now we're talking about the what. What will it cost? And what will it involve? And you would have heard me speak, Maya, about the pathways and the integrated system. And what we're trying to do is just establish patient pathways. So, for example, illustration is looking at the continuum of care for a patient, either in a disease, so we'll say kidney disease, from the moment that they're diagnosed to the type of treatments and the aftercare. So we're looking at the whole continuum, because regrettably, we know that there are gaps in the services. And we also know that there may be issues where there are duplication of services, which is causing more to our healthcare spend. We spend over $770 million a year on our healthcare, which represents over 11% of our GDP, which is far higher than most jurisdictions. Third, I think, in the OECD, but our health outcomes are worse. So what we're spending doesn't equate to what our health outcomes are. So part of this process, regrettably, it is a multi-year process. The steering committee has come together representing different industries within our health profession, insurance, doctors, et cetera, to help guide this discussion, because we know that we don't have all the expertise within the Ministry of Health. But it is a multi-pronged approach, and we're certain that we're on the right trajectory. However, it will take some time for us to get there.
Thank you. And my last question, if you know it, Minister of Health, what age group is the least uninsured?
I don't have that in front of me. I know I can say that we have approximately 12% of our population are uninsured. I believe that it's actually more of our senior population that represents the highest demographics that are underinsured. And you could appreciate that's no doubt because they do, unfortunately, perhaps many of them have more medical frailties than most. And that paying for health coverage obviously is a concern for all of us. But insofar as the actual demographics, I don't. But I believe it is more underinsured, represents a higher entity of individuals with respect to our age demographic.
Thank you very much. Those are my questions.
Thank you, Maya. We'll now take questions from Gary Skelton of the Bermuda Broadcasting Company.
Thank you, ministers. First, Health Minister, as you said, the throne speech lauds a digital health strategy that will streamline administrative expenses. There will also be mergers on the administrative side to cut more costs. Streamlining, merging of services can sometimes be terms that lead to job losses, something like that. Can you tell us exactly how services will be cut, how costs will be cut? I'm sorry.
Okay, I'll start with the digital health strategy. I'm not a techie per se. However, I can appreciate the advances in technology and the benefits of the use of technology, particularly from a cost-saving measure. The hospital is actually currently in route to having electronic medical records. One of the regrettable phenomena that we discovered with respect to COVID is the absence of electronic medical records. So it was very difficult for us to be able to trace who's been vaccinated. We've built a system around that, but if we had electronic medical records so that we could see everyone's vaccination status and so forth, we know that that would create a huge cost savings. One of the first places that I visited as a minister of health was the health clinic. And when I saw that the records were actually, I mean, my record was probably in there from 50 years ago. They're still paper-based. You know, I know. And we know that we know the benefits of technology, and it has served us well in other areas of government as well as in private practice. So part of that is to develop a strategy so that we can tie in the use of medical technology so that we can help cost savings as well as unnecessary duplication. The second part of your question, Gary, as it relates to the merging of the administration of government plans, you'll know that a couple of years ago, we merged the administration of the HIP and Future Care into one administrative office. So we've already seen cost savings in that regard. So what we'll continue to do is look at the administration of merging the GEHI, which is a government plan, as well as HIP and Future Care, so that we can see cost savings with respect to the administration processes being shared. So it's not envisioned that there will be any job losses as a result of that. We're just trying to take steps to make it more efficient and run smoothly and have a cost savings in that regard, because we'll still have the same people that are doing case management for GEHI will be required to do case management for HIP and Future Care, as an example.
My question is, how does that, therefore, how are you reducing the costs? How is what are you not paying for? What are you not paying for?
Principally through efficiencies. We've got one department over here that's managing administratively GEHI, and we have another department over here that's administratively managing HID. We need to create more synergies and more efficiencies with respect to the management of all government health insurance. I think we insure almost 8,000. Don't quote me, but it's around that amount per year, just as the government insure with GEHI, HIP, and Future Care, which is, of course, one of the biggest insurers in Bermuda. So through the amalgamation of the administration of those, we're bound to see cost savings and efficiencies.
Okay. I'm not an economist, but outside of perhaps minor administrative cost savings, I can only visualize 4 methods of insurance premiums coming down long-term and a long scale. A reduction of services available, fewer people delivering services, healthcare professionals accepting lower payment for services, or a larger portion of everyone's healthcare being paid for by external services or wealthy contributors. Would you agree that the cost of health insurance can only come down if one of these 4 happens? And are they involved in your plan?
Well, part of the plan, and I'm not an economist either, but part of what we're looking at and what the steering committee is looking at is international best practice. We're not the first country to develop universal health care, and we won't be the last. And so those are the conversations that we're having. We also recognize that cost savings can be either individual patient or system. Right? If we are able to save within a system, then clearly the benefits will trickle down to you and I as the end users. So I'm not sure I would agree with you that those are the only 4 scenarios in which we could see cost savings. We need to recognize that if you have a benefit, right, and when you add benefits, just like we would have seen the other day when we added maternity benefits and more prescription drug benefits, there's a cost associated with that. If you're going to increase a benefit, you're going to have to pay for that benefit, which associates with the cost. However, if we're able to demonstrate the ability to have system-wide changes, then that money the savings that we're going to get within the system will matriculate throughout the whole healthcare system. A $770 million a year spend isn't just what you and I are paying for our premiums. It's the cost of overseas treatment. It's the cost of perhaps unnecessary laboratory or high technology types of treatment and the like. So there's a number of issues. I don't want to dummy it down, but it is an extremely complex phenomenal. We are not the first country, but the great thing that I'm pleased with is the fact that we have a committed steering committee representing all walks of life that are committed to ensuring that Bermuda takes the right steps to get a Bermuda-centric universal health coverage so that you and I and everyone else can benefit.
My final question, running on from that one, and you did speak about potentially unnecessary high technology or forms of healthcare. It isn't that hard to argue that our health insurance system has been designed by and for the wealthy, the variety of doctors and services available, the fact that we have more MRI machines per capita than anywhere in the world, bar Japan. All this makes healthcare more expensive for the average Bermudian. So how can we possibly cut costs without reducing the number of services available?
Some of those matters are being discussed as we speak with the Health Council, such as things like overutilization and how do we address things like utilization. You know, unfortunately, we know that some people shop around, and I Google WebMD probably far too much, and some people might do that, self-diagnose themselves, go to a doctor, ask for a particular type of expensive treatment or test, receive it, and then go around to another doctor because they're not satisfied with the result because they're certain that there's something there. And we see that. And overutilization is not just a phenomenon that exists in Bermuda, it exists in other jurisdictions. And one of the things that the Health Council has been charged with is to look at how we can address overutilization so that we can start to drive our costs down.
Thank you, Minister. And Minister of Education. I wondered if you could, this question probably falls to what you're saying is happening shortly, prototyping of these signature schools. What I wanted to know, what kind of crossover will be worked out for students who want to study specialisms or get experience in areas that are available at the different schools? Because obviously Berkeley will have a program in health, Cedar Bridge a program in science. Wouldn't someone studying in healthcare or to be a doctor need both of these? So will students move between schools? How will this feature in your prototyping?
Initially, and quite honestly, that's a question we seem to get almost every time we talk about signature schools. Initially, that is not it. It's just not something that has to be that we plan to have worked out. Remember, we are planning to introduce a total of 5 signature schools and then 2 additional ones for an alternative education system and for students with exceptionalities. But with the 5 signature schools that we want to have in place and 10 signatures between them, it is going to be imperative that the system that we have, which we'll talk about introducing our students to the various options they have at the primary level. So they choose the one where they can go and do what they are mostly interested in. There will have to be a system in place that will allow some cross learning between schools. And so that is something that is in the plan, but it's not something that we'll be able to implement with the opening of signature schools in 2022.
Okay. Really like to get more information about this prototyping. What can we expect to be happening this November for the people who sign up for it?
You'll be in the room. First of all, it will be in person, adhering to COVID protocols, of course. And if there's a limited amount, we're only allowed, I think, large events is only at 30. And so it'll only be a maximum of 30. So that's why we're getting people to sign up as quickly as you can if you want to be in the room. But you will be having presentations from the Learning First team on what will be taught, how it will be taught, the types of things that students will interact, the ways teachers will interact with students. And what we want is honest feedback from the general public. And to put it in perspective, Gary, when we go back to when we were developing what would be the final signatures, there was a huge amount of research that went into that, talking to industry, talking to business partners, whether it be the exempt companies downtown to the entrepreneur that's around the corner, and to see what is it that we need to get our children experienced in. And when we entered into that, based on the research that we did, we had 11 signatures, but you recognize that we have 10. Why did we go down to 10? It's because the further consultation with the people who will be most affected by that, it turned out that entrepreneurship, the people do not want it as a signature. They want it to be integrated into the curriculum from primary school through high school. So that was removed as a signature. And that's the type of collaboration we want when we go out and talk to the public, because we're designing a system for Bermuda by Bermuda. And so this is why we will continue to get persons to come in, because they're going to show us stuff that may have been overlooked or may not even have been considered. And so that is what we're looking at. So the people will come, they will be exposed to what these signatures will be like, what has been developed using the system transformation teams on how they should be implemented, how they should be taught, and the like. And persons will be able to give their opinion, which will help shape what the final curriculum and how they're implemented looks like.
Thank you, Minister. And my final question, if you would indulge one that steps partly aside from the throne speech, although you did mention in your statement about the frustration that teachers, parents may have had trying to make education work during COVID. Rare that I have both the education minister and the health minister together. So yesterday, Minister Rabain, you told me that there had been work with the quarantining of students who were in perhaps when there's been exposure, to reduce the number of students that are taken out of school, to keep more students in. Perhaps, Health Minister, you could expand on that. Can we expect in the future? I know maybe the last two exposures, there's been it hasn't been a full classroom quarantined, it's been a reduced number. Is that the intention ongoing, to keep as many students in school as possible?
Absolutely. The intention has always been, first and foremost, the safety of our children, as well as the staff and the teachers that support them. However, this also has to be weighed against, yes, of course, the pandemic and COVID. What we're doing, working with the Department of Education, is to look at basically a redefined role and the definition of close contacts. So in circumstances where an individual is deemed to be a close contact, then their circumstances would obviously require various public health measures, such as testing and isolation, as a person opposed to a person that's a casual contact. I think you and I have chatted about this previously. It's really important for members of the public to appreciate that a risk assessment is done first. So before any decisions are made as to who's required to quarantine, who's required to test, or who's a close contact or a casual contact, we have to go in and establish the risk, the level of risk. What was the level of engagement and interaction of the case person with those persons around them? But what we're doing is narrowing not narrowing, but we've redefined effectively what close contact is. So if an individual is a case, a positive case, and persons that are within their close proximity for a period of 6 feet over 15 minutes in a 24-hour period would be defined as close. If they're all on the other side of the classroom and the risk assessment has established that child sat right in their seat, and the persons that are in close proximity within 6 feet, those persons would be identified as close contacts and would require the public health measures, whereas somebody that's sitting on the other side of the classroom would not be defined as a close contact. They would be defined as a casual contact. So we liaise with the school through the epidemiology and surveillance unit, as well as the case management unit and the school surveillance, to indicate, based on the risk, what individuals will be required to have been identified as close contacts and therefore will be required to test and isolate, and which ones are casual and being able to return to school, but of course continue to follow the public health measures of wearing a mask, hand hygiene, and the like.
And just to add to that, I can definitely say that we've had a recent exposure, and I noted that the letters that came out did speak to, these are for these persons who will consider close contacts, and these letters are for persons who will consider casual contacts. So it is working, and it is a plan that's been put in place, and we're thankful for the Department of Health for doing that.
Thank you, Ministers.
Thank you, Gary. And we'll now have questions from the Royal Gazette. Sean.
Hello, Sean Connolly, political correspondent. Hello, Sean Connolly, political correspondent with the Royal Gazette. Apologies for the whole coughing thing. It's not COVID, don't worry. But just if I could start with health. You keep talking about a several-year plan and there's no definition of when this is going to happen. Why don't you have a time scale? Why can't you say this will happen in 5 years, 6 years, 7 years?
I think it's more important to not only manage expectations of the members of the public, but also to recognize that any country that has developed universal health care does not take place overnight. In fact, some countries have taken, if you look at Bahamas and Singapore, for example, it took multiple years for them to be able to eventually provide the provision of universal health care. We can't just turn on a switch. I wish we could, trust me, so that we could have that provision, but we can't. There are steps that have to be taken along the way.
But
if
you
we
could give a
rush
strategic.
can I continue?
Yes.
If we rush it, we may mess up. And that's certainly not what we want to do, particularly when we're committed to a patient-centered approach and providing what the UN has said insofar as the necessity of universal health care for all. We do not want to create a situation where more people fall behind the wayside and are unable to access proper health care at the time and at the need that they have.
But it seems to be a bit like Narnia, you know, it's at the back of the wardrobe and you want to get there, but nobody knows quite how to do it and nobody knows when it's going to happen. Isn't it a failure of strategic leadership that you can't say this will happen within the next 5 years, within the next 10 years?
No, I think a failure of strategic leadership is to just throw up your hands and do nothing. And we are doing something. And you would see through the throne speech that part of our roadmap towards universal health care has identified 3 specific areas that we will be developing in this next year so that we can continue on the trajectory towards our objective of universal health care.
Well, when could I, as somebody who lives in Bermuda now,
I'm sorry, pardon me?
Pardon?
Oh,
sorry.
That's okay.
When could I, as somebody who now lives in Bermuda, expect to have universal health coverage?
Again, that's the question that I can't answer. I can say that within the next year, as we develop our roadmap, you can expect to hear more about the strategy that we'll be developing utilizing technology. You'll hear more about the strategy that's being developed concerning the patient pathways and the integration of our healthcare system. That's critically important so that we can see where the gaps are in the services and ensure that we're taking steps to provide a continuum of care during our patient pathway process. And you'll also be able to hear more about the strategies as we speak to merging administratively our government policies, in addition to this cost savings I spoke to Gary about. But we'll also be able to see the benefits of procurement. If you're able to procure services for 8,000 people versus a few thousand that are in HIP and future care and a few thousand that are on GEHI, you'll be able to generate cost savings in that regard as well.
And has COVID knocked it back further?
Absolutely. It's with regret that the same people that are championing the ministry and helping us fight this COVID battle are those same people that I'm calling upon to assist us with respect to the transition to universal health care. We, as I've indicated, now have the Universal Health Care Steering Committee who are assisting us, coming from all walks of life, Bermuda First, the Medical Association, patient representatives and the like, to assist, guide, and direct the path of the roadmap for universal health care.
But surely you must have had an original strategic idea of how long this would take. So before COVID, what would that have been?
No, we didn't have a strategic time of how long. We've looked at what other jurisdictions have done and how long it's taken them to implement universal health care. And as a reporter, you probably would have looked at places like Singapore and the Bahamas, which is a multi-year process to be able to get from start to finish. It's not a flip of the switch. Okay.
In the throne speech, you talked about merging systems and streamlining. Obviously, that's inevitably going to involve job cuts, isn't it?
No, actually, when Gary asked that question, I don't anticipate that at all. For example, in
how do you cut costs then if you don't cut jobs?
Because we're making it more efficient. When you're making it more efficient, it doesn't necessarily equate to having to cut costs. Cut jobs. If you have persons that are providing a service with respect to GEHI, such as case management, I'll just use that as an example, helping to manage persons' cases for going overseas and the like for treatment, those persons are going to still be required when we merge administratively, because there's still going to be patients that were formerly on GEHI and patients that are on HIP and future care. So those same patients will need to be addressed, and provide the provision of that type of service will still be
So you can
required.
guarantee now then that there won't be any job cuts because of
I
that
can't
policy?
guarantee that I'm going to be here tomorrow. So I'm not going to make that type of guarantee. But what I can guarantee is that the government remains committed to the development of universal health care and putting patients at the center of this healthcare process, and that the roadmap that's outlined for the first year in the throne speech is the beginning steps to get us there.
So you can't guarantee that there won't be any job cuts?
I can't guarantee that I will be here tomorrow.
Well, that's not the question.
But that's my answer.
You've used words like digital strategy and integrated patient pathway. I mean, that's just like jargon, isn't it? I mean, what does that actually mean?
It means creating a digital strategy for healthcare. And as I spoke to Gary about, so that we can utilize the benefits of technology to help to make our healthcare system more efficient. The issue about patient pathways, like I said, is looking at the continuum of care from the beginning to the end of a patient's needs and assessing those cares. The illustration I used for Media Maya was with respect to a particular diagnosis, looking at the pathway from the moment the person is diagnosed to the treatment plan to the aftercare, so that we look at all of that to ensure that there's no gaps in the system. Again, putting patients at the center of our healthcare is our objective.
Okay, on COVID, is this just something we have to live with now, just like flu and everything? You know, it's just going to be part of our annual lives. You know,
unfortunately, it looks like that's going to be the case. The science and the evidence does suggest that perhaps in 3 years' time, not in time, but in total in 3 years, normally pandemics will shift to an epidemic mode, and therefore it will be part of it. It may be a seasonal issue like we do with the flu. So if it's on this side of the hemisphere, it's in the winter, and this side, and so forth. But it is something that looks like, by all accounts, regrettably, that we're here to live with that pandemic, live with COVID, excuse me.
In the NHS today in the UK, like they're bringing in, you know, mandatory vaccine for workers and care workers. Is that something that Bermuda should look at?
Those are discussions that we are having at a cabinet level and at a caucus level. What has been the position heretofore is that vaccines are a matter of choice, and that you have the option to have the vaccine. You can speak to your physician, which we're encouraging people to do if in doubt. We have been supplied with quite sufficient supply of vaccines from the United Kingdom, and we will continue to provide that vaccine free of charge to persons who wish to avail themselves of that.
What's your personal view for health workers, though? Would you be minded that they should actually have the vaccination to treat patients?
I would be mindful of persons making sure that they provide that they're provided with the opportunity to have the vaccine if in doubt. And you would hear me, well, you've just arrived, but I've been doing press conferences far too long. And we're always saying it's important for you to ask your doctor to provide you with the information that you require if in doubt. At our vaccine clinics, we have doctors on hand so that people can ask questions and educate yourself and utilize proper scientific resources as opposed to WhatsApp or some of the other social media.
Okay, thanks. If I could turn to education. Minister, are you concerned by the level of racial segregation in Bermuda schools? I mean, it seems like the private schools are overwhelmingly white. I mean, is that an issue, do you think?
Do you have any data that supports that? Because
I know it's just an observation I've had.
Okay, so it's just anecdotal because from what I do see that there's quite a balanced racial makeup of our schools in Bermuda.
Yeah. So you're quite happy with the way it is? Yeah. Critical race theory has become quite an issue in America recently, particularly in the Virginian gubernatorial election last week. Do you have any views on that? Does that have a role in Bermudan education?
I understand it seems you have just arrived, but it is something that we have. The implementation of Bermudian history is something that has been a discussion that has been going on for years. And if this government has committed to and has started research into what an enhanced Bermudian curriculum would look like.
Yeah, right. Okay. Were education custodians told they wouldn't get paid for overtime?
No.
Why not?
You said, were they told they would not get paid for overtime? I said, no, they were not told.
Yeah, but why were they not told?
I'm not quite understanding the question.
Well, surely it would have been a courtesy to tell them.
The custodians, you're referring to the walkout, the half-a-day walkout we had last week. There was a mix-up in communication. The custodians have been that has been resolved. It was a paperwork issue. The custodians were always going to get that overtime pay, but it was a paperwork issue that prevented it from being paid last week, and it will be paid this week.
Okay. The signature schools is going to take 4 to 5 years, is it? Is that a bit long? Is there any way to fast track that at all?
The signature schools, we intend to have 2 signature schools in place in September 2022. In order to correctly develop a curriculum for a program such as that, it requires around 18 months of actual work to do it. And this is not something, as we are talking about the education of our future generations, it's not something that I wish to fast track or just to check the box. It is something that has to be done correctly and has to be done in a manner that is befitting for our students.
Okay, so just now you mentioned a COVID incident. Have there been many of those this term at all? Regarding teachers or pupils?
There have been some.
How many?
There have been some. As they are private matters. All the Department of Education is contacted to say that there has been a COVID exposure. There have been a few. There have been very few in the public school system, as we only went back in a few weeks ago. But there have been a few during the course of school return.
What are we talking? 10, 20?
I don't know those numbers off the top of my head.
Right. Okay, great. Thank you.
Sure.
Thank you. Thank you, members of the media. Thank you, Minister. And both ministers, thank you. That concludes our press conference today.
Thank you.
Thank you.
Thank you.